you are injecting absolute alcohol, which is highly toxic, directly toxic to the heart muscle, which causes heart attack and causes death of the heart muscle.
We are giving a heart attack in a controlled manner.
Inducing heart attack by alcohol-injected procedure saves a patient's life at Manipal Hospital in Bangalore. This was used as an unusual technique method involving the injection of alcohol to cause a localized controlled heart attack. Shrink the thickened heart muscles to treat a hereditary heart condition. A 30-year-old man approached Dr. Saikat Kanjilal, consultant interventional cardiology at Manipal Hospital. A thorough evaluation showed that the patient was suffering from a genetic health condition known as hypertrophic cardiomyopathy.
We said it has been done earlier, but it's not a very common procedure. This is done for a genetic condition called as hypertrophic cardiomyopathy. Now, like I said, the hypertrophic cardiomyopathy, the presentations are varied. Majority of the patients can have a normal life without even knowing they have hypertrophic cardiomyopathy, and a percentage of patients come in with symptoms. Now, in patients who have symptoms, the most common treatment is medical treatment, and majority of the patients on medical therapy of hypertrophic cardiomyopathy do very well and don't require any intervention or surgery. Now, there is a small percentage of people who are not doing well on medication. They are symptomatic despite the medication, and they have other risk factors and criteria which we look at. And if they fulfill that, the scientific data favors surgical, myectomy as we call it, or reduction in the muscle mass. Now, some patients are not fit enough for the surgery, or some people choose not to undergo surgery. For such people comes in the alcohol septal ablation, and the alcohol septal ablation, to do that, you should have a suitable anatomy. There should be thickness in the appropriate areas, and the blood supply to those thick muscle has to be anatomically suitable for us to do this procedure. So once you've gone through all these checklists, that's when you say that this patient is then is eligible for this procedure. And once you find an eligible patient for this procedure, then you have to meticulously plan it, because you are injecting absolute alcohol, which is highly toxic, directly toxic to the heart muscle, which causes heart attack and causes death of the heart muscle. So if you don't do it in a very well-planned, meticulous and well-controlled manner, and if this alcohol penetrates into areas where you do not want it to penetrate, you could lose the patient on table. The patient could have a massive heart attack and die on table.
Wherein we go into the place of the heart, which is thickened and hypertrophied. In that, exactly, we keep a balloon over there and we inject small amount of alcohol. Small amount means how small? It is only 1.5 ml which we injected in this patient, and this alcohol is also an absolute alcohol which is almost 99 to 100% pure. We targeted a specific location where the muscle were thick, and because of that we were able to induce a small heart attack in that place, really leading on to a reduction in thickness of the muscle. By doing so, the thickness of the muscle reduced in this patient and his symptoms went away with that. So this is a peculiar condition wherein we used alcohol to treat the patient's heart.
So what would be the cost of this?
See, the absolute alcohol is available through, it's a chemical that is available, not very expensive to procure. It needs to be sterilized. So the cost is of any other, like an angioplasty procedure. So, it varies between 1.5 to about 2.5 lakhs.